Hello, everyone, and good afternoon. I'm Tony Shi, president of United Hospital Fund. On behalf of UHF, our board chair, John Simons, and today's event chair, Carrie Kravitz, I'm very pleased to welcome you to our annual Tribute to Excellence in Healthcare, recognizing quality improvement champions. Of course, we all wish we were together in person for the celebration, but I'm delighted that you're able to join us virtually this afternoon and that we have excellent attendance from the healthcare community across the tri-state area. Needless to say, it has been an extraordinarily challenging time for the healthcare community. As everyone in this group knows too well, the COVID-19 pandemic has claimed a horrific number of lives and livelihoods, and has challenged our region's healthcare system as never before in modern times. And the pandemic has exacerbated already existing health disparities, especially among Black and Brown communities. At the same time, during this past year, we have also seen the great strengths and extraordinary commitment of our healthcare workforce. We have a very special program planned for today's tribute. We honor 73 quality improvement champions who have distinguished themselves for their tireless work to drive improvements across the full continuum of patient care, who have risen to meet the new and daunting challenges posed by COVID-19, and who are addressing critical health equity issues. These outstanding honorees were chosen by the leadership of 69 hospitals and health systems, long-term care facilities, home care organizations, independent practice associations, and federally qualified health centers throughout the greater metropolitan area. Following our keynote from Dr. Ashish Jha, we'll focus our attention directly on our honorees. We will hear from some of them in their own words, and then we'll briefly highlight the important accomplishments of each honoree. But now, let me introduce and welcome our event chairman, Carrie Kravitz. Carrie is the president of Kravitz Incorporated, the luxury home furnishings and fabric company. He is a board member of United Hospital Fund and a trustee of Northwell Health, where he chairs the Quality Committee and the Advisory Board of Cohen Children's Hospital.
Thank you, Tony, and good afternoon, everyone. I'm very pleased to chair today's event to pay tribute to our truly impressive and inspiring honorees. A number of organizations and individuals have provided generous support for today's tribute, and we are so appreciative. First, a very special thank you, once again, to TD Bank. TD Bank is the lead sponsor of today's tribute, and we are grateful for their support. Emmett Conlon, head of U.S. Healthcare at TD Bank, and a number of his staff are joining us for today's event, and we're so pleased to have them with us. And thank you to our generous supporters at the leadership level. Finally, thanks to all of our generous supporters who are listed in today's event journal, and to all of you who are taking the time to attend this tribute. Back to you, Tony.
Today's celebration of healthcare excellence is part of United Hospital Fund's broader work to build an effective and equitable healthcare system. Many of you are familiar with our work, but for those who aren't, we focus on three central challenges facing healthcare. First, coverage and access. Just before the pandemic hit, more than 1 million people across our region were uninsured, and countless others, even with insurance, struggled to pay medical bills. Today, many more have lost coverage as they have lost their jobs. UHF's independent analysis and program initiatives support efforts to achieve universal and affordable health insurance coverage. Second, quality of care. UHF employs a wide range of strategies in the quality arena, and we are proud to be working with many provider organizations across the region on our shared goal of advancing quality and patient safety. Indeed, this tribute today was created to recognize and nourish the often unrecognized work that all of you do. And the third focus area for UHF is clinical community partnerships. It's very clear that factors outside of the healthcare system, such as inadequate housing, poor nutrition, unemployment, and poverty, greatly impact an individual's health status. But the pandemic has brought this truth home in the most heart-wrenching way. Our work is fostering collaborations between the healthcare system, public health, social services, and the community to address the unacceptable inequities that are driving health disparities. I truly believe UHF's work has never been more important, and we are grateful to our many partners in this work. Before I introduce our keynote speaker, I'd like to introduce one of our most valued partners, Lorraine Ryan, a leader committed to advancing quality improvement and high reliability in patient care. Lorraine is Senior Vice President of Legal, Regulatory, and Professional Affairs at the Greater New York Hospital Association. Lorraine and Greater New York have partnered with us on our quality improvement initiatives for more than a decade.
Thank you, Tony, for your kind and generous words. On behalf of the leadership of the Greater New York Hospital Association, Ken Rasky and Lee Perlman, I thank you for the opportunity to participate in today's program and to pay tribute to those being honored. Greater New York is proud to work closely with UHF in partnership with our member hospitals and continuing care providers across the region who share our dedication to improving the care provided to the communities we serve. Today's gathering is an affirmation of that partnership and the deep caring and broad expertise of our members. It is an honor to support the tribute and to congratulate all of the honorees for their outstanding leadership, perseverance, and dedication to patient care, particularly during the past very, very challenging year. Many thanks and congratulations to you all.
I am now pleased to introduce today's keynote speaker, Dr. Ashish Jha, Dean of the School of Public Health and Professor of Health Services Policy and Practice at Brown University. A practicing internist, Dr. Jha is recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. He has led groundbreaking research around Ebola and is now on the front lines of the COVID-19 response. Dr. Jha has published several hundred original research articles in the most prestigious medical journals and is a frequent media contributor, including regular appearances in the New York Times and the Wall Street Journal. Today's audience is likely familiar with his seminal work on improving the quality and efficiency of healthcare. Prior to his roles at Brown, Dr. Jha was a faculty member and held several leadership roles at the Harvard T.H. Chan School of Public Health and Harvard Medical School. While we can't fully claim Dr. Jha as a New Yorker, he did graduate from Columbia University before moving to Harvard for his medical degree and completing his medical training in San Francisco and Boston. Welcome, Dr. Jha.
My name is Ashish Jha, and I am the Dean of the School of Public Health at Brown University, and it is such a delight to be part of the United Hospital Fund's annual celebration of excellence, and this year honoring the 2021 Quality Improvement Champions. This has been a very, very difficult pandemic. We are, depending on when you want to start the clock, 15, 16 months into this pandemic. It has taken an extraordinary toll on all of us. It has cost so many lives lost across the United States, tens of millions of Americans infected and sickened by this disease. And in many ways, it has been a public health failure, that there have been so many failures in the public health system. Our failure to get testing and tracing going early, the politicization of mask wearing, the real challenges with social distancing. But today we celebrate the successes, and some of the most important successes have come from the healthcare system, from people on the front lines who bore the brunt of that burden of all these people getting infected and the way the healthcare system responded. And that is the focus of my remarks, and I'm going to get to that in a minute. But I want to just talk for a minute about the arc of this pandemic. What started probably in November, December of 2019 in Wuhan, China, spread quickly across the world, and the disease was probably spreading quite substantially throughout much of February of 2020. But we, in the healthcare system, and particularly for those of you around New York, really encountered it for the first time in March. That's when you really started seeing the number of infections ticking up, and by April and May, it was overwhelming. And the response in New York and elsewhere was really extraordinary. And things subsided and they got better. And as we went into the summer months, we really saw a surge of cases across the South and Southwest. And then in the fall and winter, it was really everybody again, consumed. But this year, 2021, has been going much better. And while we have seen surge of cases and lots of infections still out there, it's nothing like the fall and winter of 2020, and driven in part by the remarkable progress of these vaccines. These vaccines really are extraordinary. They are scientific marvels. And they come on the heels of years and years of very good basic science work that allowed us to be ready to build these extraordinary vaccines. And now these vaccines are getting into the arms of tens of millions of Americans, and we will get this pandemic under full control. The summer looks very bright to me. The fall and winter of 2021 we may see a bit of a surge of cases, but it'll be nothing like what we saw in the past. And I do believe the worst of the pandemic is behind us. And that is terrific. There's still lots of challenges ahead. We'll still need to deal with testing. We still need to get the world vaccinated. That remains a major challenge. So I don't want to suggest that the pandemic is over. But I do want to say that we're in a different phase now, and things are clearly better, and they're going to continue to be better as we go further into the summer and into the fall. And while that is happening, I want to take a minute to talk about what went right. Where did we see the most impressive work? I've already mentioned the scientists who built the vaccines, the scientific model and enterprise that allowed us to build these vaccines out so quickly. That has to be celebrated, has been, and I think needs to continue to get attention. But today I want to talk about another area where I think there's been incredible success, but not enough attention. And that's the work of a whole lot of frontline, not just the clinicians, the doctors and nurses who've done extraordinary work, but the people behind the scenes, the people who've been building up the infrastructure, implementing quality improvement. And I'm going to talk specifically about the data we have for why that has been so impactful. And I've had a chance to review all of the reasons, all of the extraordinary work that you've all done, and what has been the sort of signature items that has led to each of you being honored. And while I would love to take time to go through all of them, I'm going to lay out what I think have been the big things, and then you will see your story in it. Because almost every area where we have seen extraordinary progress, I now, in this award, can see the names and the faces that underlie that progress. And I am looking across at a whole group of people, and I wish I could name all of you. I can't. But there really is extraordinary work that's been done by the group that's being honored today. So let's actually go back to think about what are the big successes? Where did the healthcare system get things right? What did they do well? And in those stories, you'll see your work. So I think back to the early days of March and April when we were shutting down so much of our society. We were canceling primary care appointments and specialty appointments and canceling elective surgeries. Guess what? People still needed care. You still had people with chronic disease who still needed care. Those of you who stood up telemedicine quickly and rapidly and made healthcare as accessible as possible under a crisis, that deserves attention and praise. By April, May, it was very clear we were not doing enough testing. We weren't identifying people who were infected. If you couldn't identify them, you couldn't isolate them, they would spread it to other people. It was a huge problem. And so huge thanks to those of you who worked on standing up the testing infrastructure. Because testing infrastructure is incredibly complicated. It's not just about having the swab and the reagents. Right? It is about the entire infrastructure for getting people into place, for having people be able to perform those tests safely. That was extraordinarily important. Being able to send those tests off to labs, get results back, have the IT system that manages all of this, report that to the state health department. I mean, just extraordinary work that several of you were so instrumental in standing up. So thank you to all of you who've done that. One of the stories I saw consistently in the write-ups about what all of you have been doing is something I've been thinking a lot about, which is the extraordinary teamwork that went into taking care of people with these novel infections. We didn't know anything about taking care of this virus a year and a half ago, right? We had to learn. We had to learn on the fly, and we had to build new clinical protocols, bring doctors and nurses and critical care specialists and emergency doctors and radiologists and everybody together. So many of you were involved in that teamwork that needs to be done on the clinical side, and others of you were involved in the teamwork that needs to support the clinicians, and that was extraordinary. By the way, one of the points I would like to make to people, and people underappreciate, is, I have been working on quality improvement for a long time in my life, and I saw the power and impact of quality improvement in this pandemic. And here's a simple statistic that I think captures that. The average person walking into the hospital today, hospitalized today with COVID, their chances of dying from COVID are about 50% lower than it would have been a year ago. That is amazing, amazing progress. There is no disease I can think of where we've lowered mortality by 50% in a year. Now, some of that has come from new therapies, a little bit. Certainly dexamethasone, some other immunomodulators, maybe remdesivir, but that's not most of the improvement. Most of the improvement in mortality has come from process improvement, from quality improvement, from figuring out who needs to be hospitalized and who doesn't, figuring out how to manage people off the ventilator, the role of proning, the role of non-invasive ventilation, figuring out who really needs a ventilator and who doesn't, right? Figuring out how to prevent complications for people who are in the ICU, on ventilators, otherwise. Some of that is medical scientific. A lot of that is classic quality improvement, and that has made an enormous difference. I think it's probably the biggest reason we have seen that huge drop in mortality. And if you can take a disease and cut its mortality in 50% in a year, that is extraordinary achievement, and that's what we have seen here. There are many of you who are involved in the data and analytics to figure out how to do that work much, much better. There were a group of you who were involved in hospital-acquired infections and making sure that hospitals were safe places, because we needed to be able to bring other people back, people who needed elective surgery, people who had heart attacks and strokes who needed hospital care. They needed to feel comfortable that they weren't going to get COVID in the hospital. We actually needed to tackle COVID as a disease that did not spread in hospitals, and a bunch of you worked extraordinarily impressively on that. And then as vaccines started coming into the picture in December and January, one of the points I've made often publicly, but you have lived and actually demonstrated, is vaccines don't give themselves to people. Vaccines don't save lives. Vaccinations save lives. And there is a big path, a big divide between developing these extraordinarily scientifically brilliant vaccines and getting them into people's arms. And so many of you have been involved in that. So I want to wrap up by saying, this has been an extraordinarily difficult 15, 18 months. We're not done with this pandemic. We have a global pandemic that we're going to have to continue to manage. But we are on the other side of the mountain in terms of the challenges here in the United States. And while the losses of life have been extraordinary, the infections have been so extremely high and so devastating to so many families, what I am absolutely crystal clear on is the work you have done on the front lines, building the infrastructure, delivering the care, improving the quality of that care, has been central to saving hundreds of thousands of lives. And you won't know whose lives you've saved, right? But you have. And that means there are people who are going to get to enjoy Memorial Day and July 4th with their family who would not have otherwise if it wasn't for your work. And that is why I am so honored to be with all of you today. You've done extraordinary work. I am thankful to the United Hospital Fund for honoring all of you. I'm thankful for UHF inviting me to be a part of this event. I wish I could be there in person. I realize this is virtual for all the reasons we've been talking about, but I look forward to the opportunity to get a chance to meet many of you in person at some point in the future, and thank you personally for your great work. Be well, stay safe, and thank you again for the extraordinary work you've done on behalf of all Americans.
Thank you very much, Dr. Jha, for those powerful and inspiring comments, and for your leadership in public health and health policy. Now, I'm so pleased to begin the recognition of today's honorees. United Hospital Fund created the Tribute to Excellence in Healthcare 3 years ago to shine a spotlight on quality improvement champions who are leading efforts at their organizations to make our healthcare system more patient-focused, outcome-driven, safe, and effective. This year, we asked the senior leaders of healthcare organizations across the region to select individuals for this award who have shown outstanding leadership during the pandemic or who have focused their work on addressing the wide disparities in health outcomes. So on top of your vitally important work to improve quality and patient safety, each of you has also distinguished yourself for stepping up during a crisis, for clear thinking under great pressure, and for doubling down on your commitment to your patients and to your colleagues. By recognizing your achievements, we hope to nurture the vision and leadership that are essential to quality improvement and health equity, and to inspire those to follow in your footsteps. We do have special awards for each of you, which you will soon receive in the mail. And you'll also receive a Quality Champion lapel pin, which we hope that you will wear with pride. Today's honorees represent each of the 5 boroughs of New York City, as well as Long Island, Westchester, the Hudson Valley, New Jersey, and Connecticut. You are doctors and nurses. You are social workers and palliative care specialists, public health and infection control experts. You are frontline workers, and you are educators, and you are clinical and management leaders. On a day-to-day basis, you are tackling some of healthcare's toughest and most intractable problems. You are reducing infections and preventing hospital readmissions. You are implementing electronic medical record systems, preventing patient falls and injuries, working to decrease opioid use and delirium. Some of you care for the tiniest infants, and some provide care to children with long-term, complex medical needs. And some of you care for fragile seniors who are at the end of their lives. During COVID-19, you rose to meet all kinds of new challenges. Early in the pandemic, several of you launched large COVID testing programs. You secured as much PPE as you could. You planned for surge capacity. You secured new ventilators. You transitioned ambulatory care appointments to virtual appointments. During the darkest days of the pandemic, as the number of intubated patients rose dramatically, you opened new ICUs at lightning speed and developed new policies for ventilatory and airway management. Many of you stepped out of your regular jobs to lead the COVID response. You retrofitted standard patient rooms to negative pressure isolation rooms. You launched antibody infusion programs. A lab team at a cancer hospital developed your own COVID test, which quickly received FDA approval and allowed you to test around the clock. Several of you concentrated on ensuring that COVID patients in the ICU did not develop pressure ulcers and other skin problems. Many of you worked around the clock. A number of you focused intensively on health equity. One of you is a pioneer in using electronic health data to identify and tackle racial and ethnic disparities in a range of chronic conditions like hypertension and diabetes. Several of you made sure that patients and families with limited English proficiency received information in their first language. One of you has provided care for the past 18 years to underserved Asian populations in Chinatown. To address the devastatingly high COVID infection and fatality rates among Black and Brown community members in southeastern Queens, 2 of you worked with a local church and community organizing network to operate a testing site at the church. And this model served as a prototype for 40 sites throughout the city. You cared for patients, but also for their families, organizing hundreds of visits and prayer sessions via Zoom and in-person visitations separated by a glass wall. Several of you focused on protecting the mental health and well-being of your colleagues, helping to heal the healers and minimize burnout. Many of you are now heavily involved with COVID vaccination efforts. Let me read just a few ways nominators from your organizations described you. She is dedicated, trusted, and fearless. He has been the right leader at the right time for our hospital. The pandemic required unique focus and agility, and she had that and more and led our organization's response. The combination of her positivity and her critical thinking influences everyone around her to stay calm, even during the pandemic. He's our Dr. Fauci. She is a force of nature. She's a class by herself. He has a continuing quest to help those in need. Her mantra is that quality never sleeps. It's leaders like him whose selflessness, tenacity, and willingness to lead by example give us hope and strength. Yes, you all give us hope and strength. Let's learn more about our honorees and what inspires them. Our honorees are a wonderfully diverse group.
I was born in Sardinia, Italy.
I was born in Ecuador.
I am from Panama.
I was born in a small town in upstate New York called Olean.
I was born in good old West Caldwell, New Jersey.
I was born in Haiti.
My family's from Pakistan.
I was born in San Jose, Costa Rica.
I was born in the Philippines.
I'm from the Philippines.
My mother is from the Philippines and my father is Irish, born and raised in New York.
I was born in the Bronx.
From the Bronx.
Born in the Bronx.
In Queens, New York.
In Brooklyn, New York.
In Brooklyn, New York.
In Queens, New York.
I was born in Brooklyn, and I remain a lifelong New Yorker.
I was born in Queens, and my parents are from Guyana and Nigeria.
I was born in Pakistan.
I was born in Hamilton, Canada.
My family came to the United States from Belarus.
I was born in Jamaica, West Indies.
Jamaica in the West Indies.
From Jamaica, West Indies.
Originally from Jamaica.
In Jamaica.
From Jamaica.
The beautiful island of Jamaica.
Born in the United States, but my family are from the Caribbean.
Well, I was born in Philadelphia.
Bronxville, New York.
In South India.
In Beijing, China.
In South Korea.
In Burma, now called Myanmar.
I was born in El Salvador.
Our team includes people from more than 12 different countries and 4 native New Yorkers.
You are brilliant people who could have chosen a range of professions. Who inspired you to go into this field of healthcare?
What inspired me to go into healthcare was my dad.
And was my mom.
My mom is my inspiration.
Who always wanted to say, my son, the doctor.
My daddy, who always dreamed I would be a doctor.
My dad taught me how to care about people, and science taught me how to care for people.
My parents.
And taught me at a very young age how important it was to help others.
I came from a family of doctors.
Many of my family members were working in the healthcare field.
My father was a family doctor. My uncle was a radiologist.
A surgeon father and mother who was an OBGYN nurse practitioner inspired me to go into the field of healthcare.
My parents, who were both nurses.
My mother and Aunt Claudette were both nurses.
I was very close to my Aunt Marjorie. She inspired me to become a nurse.
My dear Aunt Joyce, who was a registered nurse, she used to come to my house. She used to practice on me. She used to do vital signs, ACE wrap, bandages.
I've always wanted to be a nurse ever since I was little.
I'd say my school nurse inspired me.
My experiences caring for my father, taking care of my elderly grandparents,
inspired me to get into the field of healthcare.
Inspired me to go into the field of geriatrics.
The nurses who took good care of my mother when she was gravely ill.
I was inspired to become a nurse because of the nurses and doctors who helped my father when he needed surgery.
I was raised one of 11 children, and we learned early on to take care of each other.
My mentor, Buddhist monk, who was a healer and saved many people's lives, inspired me to go into the field of healthcare.
My mentor was my very first infectious disease attending when I was a medical student. He inspired me to go into the field of infectious diseases.
My time growing up in EMS Explorer post in high school inspired me to go into the field of healthcare.
It was always my dream to be part of a world that cares for the pediatric population.
I realized how deeply I cared for both patients and families.
I've always been passionate about caring for both my family and the community.
My father was a very active member of our community. He has inspired me to carry on his legacy.
To help other people to live longer and healthier lives.
I was inspired by the idea of being able to take care of my people who look like me, who would come to see me and feel comfortable and safe, and I would be able to help them.
You are a humble group, and almost all of you say that your accomplishments could not have been achieved without your team. What does your team mean to you?
My team.
My team.
My team.
My team
is abundantly talented.
Is simply amazing. Incredible.
Absolutely phenomenal.
They are incredibly passionate.
My team are extraordinary heroes.
Every single one of them has chosen to be here, not because it's easy, but because it's important.
There is a real sense that the organization has a purpose, a mission.
Each and every one of my coworkers are always there to help and support one another.
We come into work each day really looking to do our best.
My team is truly like family.
My team is like my family.
Team is like my second family.
My team is like a second family to me.
We've been through so much together.
So I am so proud of this team.
Who go above and beyond their call of duty.
My team is extraordinary.
Fearless, incredibly smart,
resilient, hardworking, talented,
motivated, passionate, and dedicated.
Synergistic,
the best in the world,
and determined,
incredibly dedicated to providing safe and quality care.
And they're deeply committed to our patients, their families, and our broader community.
A powerful combination of heart and excellence.
I admire them, and I respect them, and I love them.
The projects you have all worked on are complex and multifaceted, but in a nutshell, what would you say was the secret to your success?
The secret to our success was and is that we strive every day to provide our patients with exceptional care.
The secret to our success is our ability to be resilient.
Our strength.
Our dedication, friendship, and trust. Having each other's back.
Was leaving no stone unturned.
To treat each other like the way you want to be treated.
The secret to our success was remaining determined in the face of uncertainty.
The ongoing open and consistent communication.
Making sure that proper communication was upheld.
And effective communication.
The secret to our success is to do common things uncommonly well.
Was meeting people where they were.
Meeting with our community leaders, and listening.
A huge part of our success was the pace at which we acquired new knowledge and then shared this information at every level of the organization.
The collaborative ingenuity and energy of all the departments that were involved.
We had a great leadership in our hospital.
Strong leadership support.
Was having the guidance of senior leadership.
Overwhelming support from administration, the community, and our co-workers.
The drive we have to provide exceptional care to our patients while connecting with them.
Was our ability to adapt.
The secret to our success has been teamwork.
Our COVID response was a unique teamwork approach.
The secret of our success is, I believe, is our great teamwork.
The team's cohesiveness.
Teamwork.
Both teamwork and also the ability to listen to each other.
How we work together and how we treat each other.
The secret of my project was to use a team approach.
Teamwork makes the dream work. Our team thought outside the box to practically respond to the ripple effects of the COVID-19 pandemic.
The secret to our success was grit. Grit equals passion times perseverance, and it took a tremendous amount of grit to get through 2020.
We asked today's honorees if there's a motto or quote or life philosophy that guides you and your work. And here's what you said.
A motto or quote that I live by every day when I come to work is to remember that every patient is somebody's family member. Each day I ask God to guide my hands, to take care of my patients, and to do His work.
You will make a difference in somebody's life every single day.
Deciding what not to do is as important as deciding what to do.
Our team's motto is make it happen.
To do what is necessary, followed by what is possible, and then suddenly you're doing the impossible.
The greatest failure is the failure to try.
Leaders are visionaries with a poorly developed sense of fear and no concept of the odds against them.
Do it right the first time so you don't have to do it again.
Where there is a will, there is a way.
Life is tough, but so are we.
Life is not about waiting for the storm to pass. It is about learning how to dance in the rain.
People will forget what you said.
People will forget what you did.
But people will never forget how you make them feel.
A quote that I live by is intellectual curiosity brings opportunities.
Each and every day, I have an obligation to at least learn one new thing.
Not to be scared of change. That change is one of our only constants.
Help another and have fun along the way.
A motto I live by is love your neighbor as yourself.
Do unto others as you would have them do unto you.
Just treat others how you want to be treated.
Try to be a rainbow in someone's cloud.
It's a kindness is the only investment that never fails.
In a world where you can be anything,
Be kind.
Live your life through values and principles, like truthfulness and integrity.
Be dedicated, compassionate, and always do the best work you can every day.
And lastly, a motto that I live by is just do it.
And now, ladies and gentlemen, please join me in celebrating all of the 2021 honorees.
For leadership and teamwork in the post-anesthesia care and perioperative units, Bernie R. Olivio, Syosset Hospital.
For the rapid relocation of the infusion center and conversion of outpatient areas to inpatient care, Corrine Austin, Mount Sinai, South Nassau.
For getting the hospital's COVID vaccine program up and running in 48 hours, Alina Barbar, Mount Sinai, Queens.
For immediately offering telehealth visits to patients and for her focus on improving health outcomes, Dutsi Bem, Healthcare Partners, IPA.
For spearheading a program addressing staff anxiety, Suzanne Bentley, New York City Health and Hospitals, Elmhurst.
For her strategic leadership as patients return to medical offices for continued care management, Sulin Bukri, Hackensack Meridian Health.
For leadership in caring for the sickest patients in the COVID ICU, Vanessa Kabatbat, Staten Island University Hospital.
For co-developing a partnership to operate a COVID testing site that became a prototype for 40 others, Diana Castillo, Community Healthcare Network.
For setting up a system to donate PPE to hospitals, nursing homes, and clinics across New York City, Jonathan M.T. Chang, Coalition of Asian American IPA.
For collaborating with other hospital teams to reduce hospital-acquired infections, Shannon R. Christian, Lawrence Memorial Hospital.
For leadership in the use of ultrasound technology to place central lines, and as a magnet designation champion, Lorraine Daphna, Glen Cove Hospital.
For organizing staff support, restoring ambulatory practices, and spearheading screening protocols and vaccination efforts, Berth Arisnor, Mount Sinai, Morningside.
For co-developing with her fellow honoree a partnership to operate a COVID testing site that became a prototype for 40 others, Michelle I. Everett Oxley, Community Healthcare Network.
For mounting a quick response with the medical director and fellow honoree to ensure optimal care in a comprehensive care system for older adults, Jeffrey Farber, the New Jewish Home.
For 40 years protecting staff during epidemics, and particularly for her role educating staff during the COVID-19 pandemic, Mary Ferronda, MJHS Health System.
For developing standardized processes and protocols in the ICU, Sandeep Garwin, Montefiore, St. Luke's, Cornwall.
For managing the redeployment of staff to support the COVID surge at hospitals across the system, Cindy Gurdusky, New York Eye and Ear Infirmary of Mount Sinai.
For assuming frontline responsibilities, including leading the COVID-19 Critical Care Task Force, Jason M. Golbin, Catholic Health.
For her role in reducing length of stay for hospitalized congestive heart failure patients, Diane Gordon, Montefiore, Mount Vernon Hospital.
For developing COVID policies to keep patients and staff safe, Evith Green, Advantage Care Physicians.
For high-quality care to the underserved Asian population in Chinatown for the past 18 years, Kevin Guo, Coalition of Asian American IPA.
For innovative approaches to providing high-quality skin care for COVID patients, Karina Gutierrez, Long Island Jewish Medical Center.
For redesigning inpatient care and leading the COVID vaccination program, Amra Hassan, Montefiore New Rochelle Hospital.
For helping to develop and support response and relief efforts, Una Hopkins, Montefiore Medical Center, Wakefield Campus.
For leading primary care quality efforts and the pandemic response, emphasizing equity, Tochi Iraku Maliz, Donald and Barbara Zucker School of Medicine at Hofstra, Northwell.
For leading simulation programs to improve clinical outcomes, including intubation safety, Farouk Nadim Jaffrey, White Plains Hospital.
For adjusting policy and protocol as necessary and leadership to keep staff and residents safe, Christina Jones, Gerwin Jewish Nursing and Rehabilitation Center.
For team building and support for staff and travel nurses and volunteer work in Utah, Shazad Khan, Southside Hospital.
For leading the Institute's quality improvement efforts since 1999, Kwame A. Kitson, Institute for Family Health.
For serving as COVID information czar, disseminating information and research across the system, Kurt S. Kodroff, One Brooklyn Health System.
For promoting patient safety and overall leadership during the pandemic, Ellen M. Komar, Stanford Health.
For an effective crisis response and developing life-saving protocols during the pandemic, Marianne LaBarbera, Richmond University Medical Center.
For leading a 5-fold increase in the critical care census, developing protocols and mentoring staff, Young Im Lee, Mount Sinai Beth Israel.
For compassionate and high-quality care to COVID patients, Dawn Leonard, Peconic Bay Medical Center.
For launching a new electronic medical record despite extreme challenges, Josephine Leung, Elizabeth Seton Children's Center.
For coordinating the use of ventilators and oxygen delivery devices, Vadim Leko, Mount Sinai, Brooklyn.
For providing airway management for COVID patients and transforming the anesthesia department, Dave A.F. Livingstone, Bronx Care Health System.
For developing creative safety processes, John Lohner, Montefiore Medical Center, Moses Campus.
For building safety processes and innovating to reprocess used N95 respirators, Richard A. Martinello, Yale New Haven Hospital.
For creating a nursing dashboard to drive performance and facilitate staff training and redeployment, Judy McLaughlin, the Brooklyn Hospital Center.
For frontline leadership and unwavering team support at the epicenter of the pandemic, Robert I. Mendelson, Jamaica Hospital Medical Center.
For implementing the first hospital COVID drive-through specimen collection site in Connecticut, Keisha A. Mitchell-Richards, Greenwich Hospital.
For leading daily operations and management of 4 COVID surge units, Michael D. Montanez, North Shore University Hospital.
For overseeing the creation of a virtual visitation program and addressing systemic racism, Andres S. Morena, Mount Sinai West.
For rapidly developing and implementing around-the-clock testing across 6 platforms for patients and staff, MSK COVID Lab Testing Team, Memorial Sloan Kettering Cancer Center.
For strategies that optimized employee safety and productivity, Jacqueline Myrie Weir, Montefiore Medical Center.
For helping establish a program pairing first-time mothers with specially trained nurses, Carol Adnaha, Visiting Nurse Service of New York.
For establishing a practice that cares for newborns born to COVID-positive mothers, Suzette Olubusola Oyeku, the Children's Hospital at Montefiore.
For leadership in navigating the transformation to COVID care of this musculoskeletal care hospital, Jennifer O'Neill, Hospital for Special Surgery.
For his leadership role in navigating the transformation of the hospital to COVID care from its specialty focus, Douglas Padgett, Hospital for Special Surgery.
For leadership in the Sepsis Collaborative and caring for COVID patients, Corazon Parazzo, Huntington Hospital.
For quality improvement efforts, including a proning program, Michelle Parcells, Long Island Jewish Forest Hills.
For caring for COVID patients on the front line and leading screening operations, Joe Maris Peña, Somos.
For creating and implementing multiple innovative quality and safety programs, Tessie Peter, St. John's Episcopal Hospital.
For providing critical leadership, Russell K. Portnoy, MJHS Institute for Innovation in Palliative Care and MJHS Hospice and Palliative Care.
For advocating for the safety and well-being of residents and staff, Loyola Princeville Barnett, MJHS Centers for Rehabilitation and Nursing Care, and Isabella Geriatric Center.
For inspiring colleagues and helping reduce the hospital-acquired pressure injury rate, Dahlia Puri, Cohen Children's Medical Center.
For a new approach to treating and educating psychiatric patients with diabetes, Marie Germaine Rancy, Zucker Hillside Hospital.
For improving access to care by helping unify several Mount Sinai practices, Jorge L. Rodriguez, the Mount Sinai Hospital.
For frontline leadership and unwavering team support at the epicenter of the pandemic, Alan R. Roth, Medicis Health Network.
For championing equity as a major element of quality and patient safety, Debbie Salas Lopez, Northwell Health.
For spearheading quality improvement efforts and improving the patient experience of care, Quest Ann Samuels, Plainview Hospital.
For leadership in reducing hospital-acquired infections across the system, Zane K. Saul, Bridgeport Hospital.
For maintaining the highest standards in fighting the spread of disease, Verna Sinclair, Parker Jewish Institute for Healthcare and Rehabilitation.
For leading the Infection Control Department, Susan Singh, SBH Health System.
For frontline leadership and unwavering team support at the epicenter of the pandemic, Alessandro Solinas, Flushing Hospital Medical Center.
For mounting a quick response to ensure optimal care at a comprehensive healthcare system for older adults, Ruth Spinner, the New Jewish Home.
For championing quality improvements on infection rates and COVID testing practices, Suzanne Z. Stone, Montefiore Nyack Hospital.
For helping address health and social disparities highlighted by the pandemic, Sherry Sukoff, Maimonides Medical Center.
For overseeing the proper, safe, and appropriate distribution of vaccines, Grace Y. Ting, Nassau University Medical Center.
For strategic planning around the COVID surge and other performance improvement projects, Valerie Vermiglio-Cohn, Burke Rehabilitation Hospital.
For driving quality and improvement efforts across the system, Judy Vigliotti, St. Mary's Healthcare System for Children.
And finally, for coordinating a program to reduce preventable in-hospital mortality, Danielle M. Zawatsky, Yale New Haven Health System.
Congratulations to all our honorees. We are very proud to honor you for your work and for your leadership. It's a never-ending challenge to consistently deliver the highest quality of care, especially during a time of unparalleled uncertainty and stress. A sincere thank you to our honorees for the important work you have done this past year and for all you are doing to provide the highest quality of care and caring. Your commitment and extraordinary skill leave us all hopeful that more positive change lies ahead. I will bring our event to a close with the request that our honorees stay in touch with UHF and with one another. We hope this tribute will help nurture a professional network of quality improvement leaders across the metropolitan area so you can support each other and learn from each other. Thank you again to our guest speaker, Dr. Ashish Jha, for being with us and helping United Hospital Fund convey the importance of these awards. And thank you everyone for joining us today and supporting United Hospital Fund.